Hi everyone, welcome back to Learn with me. I'm Deborah Hanson, and today we're going to be looking at AP Psychology 5.5 key terms, treatment of psychological disorders. Now, if you thought 5.4 had a lot of key terms, well, hang on to your hats because this one has double. So it's going to be a long video. Sorry about that, but we're going to go through all, I think, 50 key terms for 5.5 with a definition and example for each one to help you prepare for either a unit test or the final exam. So before we get started, thanks to everybody who subscribed to the channel. Really appreciate all the likes and subscribes, I guess you say, and comments too. Apparently that all helps my channel to grow, which is really amazing. And I love to do the content. And like I said, when I finish AP Psychology, I do tutor 3 other APs. So I will be doing videos for those as well. So let me know what you think about the content. And if you want to see me do anything else for AP Psychology, I think I'm planning on doing, I always do the essential knowledge and the key and the CED questions, but I'm also thinking of doing some, review questions and things like that. So let me know what you need, okay? Okay, let's get started. So as I mentioned, here's the list of all the key terms for 5.5. And like I said, there are a lot of them, but that's okay. We're going to go through them one by one with the definition and real life examples. So get those flashcards ready or your notes or whatever, however you decide to keep track of these. Remember, the key to the 5 is the key terms. So we got to know those. We got to be able to apply them on test day. Here we go. Okay, let's start off with evidence-based practice, EBP. I also noticed in psychology, we like to do that. We like to kind of put it into little letters at the end so that we remember them, I guess. But anyway, EBP. So here's the definition. Treatments and interventions grounded in scientific research, clinical expertise, and patient preferences. An example, a therapist uses cognitive behavioral therapy, CBT, to treat a client with anxiety because research has shown it is effective for this condition. Next, we have psychotropic medications, medications that alter brain chemistry to manage symptoms of mental disorders. So a person with major depressive disorder takes an SSRI, a selective serotonin reuptake inhibitor, like Prozac, to manage their symptoms. Biomedical therapies. These are treatments that address psychological disorders through medical or biological interventions. For example, a patient with severe depression undergoes transcranial magnetic stimulation, TMS, to alleviate symptoms when medications are not effective. Psychotherapy. Talk therapy aimed at improving emotional and mental health through communication and techniques. For example, a client attends weekly sessions of humanistic therapy to explore personal growth and improve self-esteem. Integrated treatment. This is a combined approach that includes both medication and psychotherapy to treat psychological disorders. So a person with bipolar disorder takes lithium for mood stabilization while also attending therapy to manage stress in relationships. Deinstitutionalization. Now that's a whole word, isn't it? Wow. Okay, the process of moving patients out of long-term psychiatric facilities due to advances in treatments and medication. A patient with schizophrenia transitions from a mental institution to an outpatient clinic for medication management and therapy. Informed consent. This is ensuring clients understand the nature, benefits, risks, and alternatives of treatment before agreeing to it. So a therapist must explain the potential side effects of exposure therapy to a client with a phobia before starting treatment. Confidentiality. This is maintaining the privacy of a client's information unless disclosure is legally or ethically required. So a therapist keeps a client's diagnosis and therapy sessions private unless the client poses a danger to themselves or others. Cultural competence. This is maintaining the privacy of a client's information unless disclosure is legally or ethically required. So a therapist, again, keeps the client's diagnosis and therapy sessions private unless the client poses a danger to themselves or others. Same definition as the last one. Non-maleficence. And I'm not going to lie, I have a hard time saying this word all the time, so I don't know how you guys feel about it, but it is a hard word to say. Anyway, the definition is the ethical principle of doing no harm to clients during treatment. So a therapist avoids suggesting treatments that could worsen a client's anxiety, such as intense exposure therapy without proper preparation. Okay. Fidelity and responsibility. So therapists maintain trust and uphold professional responsibilities in their practice. For example, a psychologist adheres to ethical guidelines and avoids dual relationships, such as treating a close friend. APA ethical guidelines. These are standards established by the American Psychological Association to ensure ethical practice in psychology. So, for example, a psychologist adheres to ethical guidelines and avoids dual relationships, such as treating a close friend. I think that was the same example as we had last time. Cognitive behavioral therapy, CBT, is a therapy focused on identifying and changing negative thought patterns and behaviors. For example, a person with social anxiety learns to challenge negative thoughts like everyone will judge me and gradually practices speaking in public. Exposure therapy. This is a behavioral therapy technique that involves gradually exposing clients to feared stimuli to reduce anxiety. So, for example, a client with a fear of flying starts by looking at pictures of airplanes, progresses to sitting in a stationary airplane, and then eventually takes a short flight. Behavioral therapy. Therapy that applies principles of learning to modify maladaptive behaviors. For example, a child with ADHD is taught to earn rewards for completing homework and avoiding distractions, reinforcing positive behaviors. Psychoanalysis. This is a therapy developed by Sigmund Freud that explores unconscious conflicts, desires, and experiences to resolve psychological distress. So, for example, a client discusses their dreams and childhood memories in therapy to uncover unconscious fears that contribute to their anxiety. Humanistic therapy, a client centered approach focusing on self acceptance, personal growth, and achieving one's potential. For example, a therapist provides unconditional positive regard, helping a client with low self esteem feel accepted and valued during their sessions. Family therapy. Therapy that addresses issues within a family system, focusing on improving communication and resolving conflicts. A family attends therapy to learn better communication strategies after a divorce that has caused tension between parents and children. Group therapy. This is a form of therapy where multiple individuals with similar concerns meet together under the guidance of a therapist. A group of individuals recovering from substance abuse meet weekly to share experiences, learn coping strategies, and to support one another. Individual therapy, a one-on-one therapeutic session focused on the client's specific issues, goals, and mental health concerns. So, for example, a person with depression meets privately with a therapist to explore their feelings and develop coping strategies. Therapeutic alliance. The definition is the collaborative relationship between a therapist and client marked by trust, mutual respect, and shared goals. Example, a client feels comfortable sharing sensitive information because they trust that their therapist is empathetic and supportive. Peer feedback. Feedback and insight shared among group members in group therapy to offer different perspectives and emotional support. So, for example, in a therapy group for grief, one member shares how journaling has helped them cope, inspiring others to try the same strategy. Cost efficiency, the economic advantage of certain therapy formats, such as group therapy, which allows multiple clients to benefit at a lower cost per session. For example, a college student chooses group therapy for anxiety because it's more affordable than individual therapy while still providing valuable support. Hypnosis, a trance-like state of focused attention and heightened suggestibility, often used in therapeutic settings to help manage certain conditions. For example, a person undergoing hypnosis for smoking cessation focuses on positive suggestions to overcome cravings. Suggestibility, the degree to which a person is open to suggestions, which is heightened during hypnosis. While hypnotized, a person is more likely to follow the therapist's suggestion to feel relaxed and calm. Hypnotherapy. This is the use of hypnosis as a therapeutic technique to address psychological or physical concerns. A therapist uses hypnotherapy to help a patient overcome a fear of flying by visualizing calm and successful flights. Pain management. The use of hypnosis to reduce pain perception, often as part of a comprehensive pain management plan. A patient with chronic back pain practices self-hypnosis techniques to reduce discomfort without relying solely on medication. Anxiety reduction, using hypnosis to reduce symptoms of anxiety by promoting relaxation and reducing stress. So a student with test anxiety learns hypnotherapy techniques to stay calm and focused during exams. Memory retrieval myths. The controversial and often debunked belief that hypnosis can accurately recover repressed memories. While some believe hypnosis can recover childhood memories, research shows that it may lead to false memories rather than reliable recall. Psychoactive medications, drugs that alter brain chemistry to treat psychological disorders by affecting neurotransmitters. So a person with depression takes a medication to regulate serotonin levels and improve mood. Antidepressants. These are medications designed to alleviate symptoms of depression by altering neurotransmitter activity such as serotonin or norepinephrine. A person with major depressive disorders takes an SSRI, a selective serotonin reuptake inhibitor, to improve mood. Anti-anxiety drugs. Medications that reduce anxiety by affecting neurotransmitters like GABA, promoting relaxation. A person with generalized anxiety disorder is prescribed benzodiazepines to manage acute episodes of anxiety. Antipsychotics. These are drugs used to treat symptoms of schizophrenia and other psychotic disorders by altering dopamine and serotonin levels. So, a patient with schizophrenia takes antipsychotic medication to reduce the hallucinations and delusions. Lithium is a mood stabilizer commonly used to treat bipolar disorder by regulating mood swings. A person with bipolar disorders takes lithium to prevent manic and depressive episodes. Tardive dyskinesia, a movement disorder caused by long-term use of antipsychotic medications characterized by involuntary muscle movements. So a patient on antipsychotic medication develops involuntary facial tics and must adjust their treatment plan. Psychosurgery. These are surgical procedures that alter brain function to treat severe psychological disorders when other treatments fail. So, in rare cases, a person with severe OCD may undergo a cingulotomy, a type of psychosurgery to reduce the symptoms. TMS, transcranial magnetic stimulation, a non-invasive procedure that uses magnetic fields to stimulate nerve cells in the brain to treat depression and other conditions. For example, a patient with treatment-resistant depression undergoes TMS sessions to improve their mood. ECT, electroconvulsive therapy. This is a treatment for severe depression involving brief electrical stimulations of the brain while under anesthesia. A person with major depressive disorder that hasn't responded to other treatments improves significantly after a series of ECT sessions. Lobotomy. This is an outdated psychological procedure once used to treat severe mental illness by severing connections in the brain's frontal lobe. In the mid-20th century, lobotomies were performed on patients with schizophrenia, often resulting in significant cognitive and emotional impairments. Okay, so now let's go through the really long list of key terms that we have for this section of Unit 5. You can do whatever you need to do. Check your flashcards, try them out, try to see if you have the definition, if you can find an example, whatever works for you. Again, you just have to know them so that you can apply them on test day or for your unit test, whatever you're doing. Here we go. Evidence-based practice, EBP. Psychotropic medications. Biomedical therapies. Psychotherapy. Integrated treatments. Deinstitutionalization. Informed consent. Confidentiality. Non-maleficence. Fidelity and responsibility. APA ethical guidelines. Cognitive behavioral therapy, CBT. Exposure therapy. Behavioral therapy. Psychoanalysis. Humanistic therapy. Family therapy. Group therapy. Individual therapy. Therapeutic alliance. Peer feedback. Cost efficiency. Hypnosis. Suggestibility. hypnotherapy, pain management, anxiety reduction, memory retrieval myths, psychoactive medications, antidepressants, anti-anxiety drugs, antipsychotics, lithium, tardive dyskinesia, psychosurgery, TMS, transcranial magnetic stimulation, ECT, electroconvulsive therapy, lobotomy. Okay, those are all the key terms you need to know for 5.5 of AP Psychology. Hopefully you've got those down. Hopefully you're learning them. Keep practicing them. If you're getting ready for the AP exam, then just go through them, all the units, all the words. How do we apply them? That is your key to the five. Leave me a comment if you have any questions. If you like the content, please hit that like and subscribe button for me. Thank you so much for listening. Have a great day. See you next time.